to use your brain. If you think of the first letter in brain, benefits, what are the benefits of doing something? When you think about the benefits, say, of changing position often, or the benefits of being in water, what if your provider came to you and said, I want to rupture your membranes? You might say, well, what are the benefits of that? Then they might come back to you and say, well, you haven't made any progress in the last 6 hours. I think if I rupture your membranes, it might help you to contract. You might think that's a good idea because I want to have my baby, right? I don't want to not contract or not have my baby. So this is just an example. And then you might ask them, well, what are the risks of doing that? And they might tell you the risks are that it may not work, or that if the baby's head is not low enough, that rupturing the membrane might bring the head into an asynclitic position, or worse, to wash the cord down in front of the baby's head. Both pretty rare occurrences, and they probably wouldn't dare rupture the membrane if the baby's head was movable, blottable. And then you might say, what are the alternatives to this? And they might offer that you could get out of bed and walk around, change your position, or maybe use a medication like Pitocin to make your contractions come back. And then, of course, you could use your intuition. What am I feeling about this information that they're giving me? Do I feel that this is a good plan? Or is there a feeling in me like, no, I definitely don't like the feeling? Your intuition is very, very good. We like to listen to a woman's intuition. And then, of course, you'll be able to say, no, not now, right? If you're like not being convinced that this is a good change of your plan or a new introduction to the plan, you can just say, no, not now, I'm not feeling it. And sometimes to get to that no, not now, you might have to say to everyone, is it okay if we have a few minutes alone that we can discuss this? And then all of us, we can leave the room, the nurses, the midwives, the doctors, whoever's there, we can leave, and you two can just discuss it and say, well, how are we feeling? What do we want? Do we want to maybe try a little longer or different positions or something? Okay, so remember that, use your brain, and then ask important questions before any procedure. And this will help you to ask those important questions. What are the benefits, risks, alternatives? What's my intuition? And should I say no, not now?